All right, Dr. Emer, we're live.
Hey guys, it's Dr. Emer, and we are doing our Pixel 8 microneedling radiofrequency treatment. You guys know what I say is the powerhouse strong microneedling radiofrequency treatment. And actually, the roar lion as their icon makes sense because this is definitely the beast of the jungle here. So you can tell it does hurt her a little bit. We don't have nerve blocks. I wanted her to try this without. And she's doing really well with the cold air and the cooling. My goal for her is overall texture improvement and a level of skin tightening. Because even though she looks in her 20s, she's in her 30s. So we have to keep her looking young forever. And so this will also improve the texture. Certain areas hurt more, like over the bone. The middle face tends to be a little bit easier. How does it feel? 1 to 10? 5?
I'd say about a 5, yeah.
Yeah, that's what most people say. I feel like, because I do it a lot stronger. I'm more aggressive with this, you guys, especially with scarring. And you guys know we just did the subcision. I wanted the filler to lift that area and the subcision to subsize the area and break apart the adhesions. So now we're going to work on the surface, getting her ready.
Will you have nerve blocks tomorrow?
Yeah, if you want them,
That's
of
course. Our
course.
patients coming to see us tomorrow.
Oh my God, of course, don't worry.
We have them for you if you
She's
want them.
strong. I had a lot of patients today who didn't need it though. They just kind of get through it. We're almost done already on this cheek, so I feel like, oh, I'm excited. So you guys see some areas bleed a little bit more.
This work for darker skin tones.
Yeah, this can be microneedling radiofrequency, you guys, is colorblind. What that means is anyone could do it. Now, there's different needles, so there's coated and uncoated. Especially if they're coated, they're definitely ready for a dark skin tone because they're much less risk
How
to develop.
often is this needed and how long does it last?
Well, these treatments are more of an ongoing treatment, but we're going to combine it with lasers to get more. The results are permanent. But you're going to continue aging. So I can't tell you the aging. I want to do it a little more frequent or combine it with the lasers when you do that every few months. So she's doing really good. We're basically done on this side.
Does this remove dark spots?
Not really, no. No. This can improve acne. So I'm going to go a little
Did she have
deeper.
to take some Valtrex before the procedure?
Not usually for this one. If they wanted to, they could. For stronger lasers like Halo, Fraxel, CO2, I would. I'm going a little stronger now, a little deeper.
You guys get rid of scars on the body.
Yes, we can. Alright, so we're basically there. I'm just doing an extra pass. You guys can tell over the deeper scar areas. Are you okay?
Yeah.
Okay. Doing really good. I'm doing like triple pass now. I kind of tricked you.
53 years old, will I get benefits from this?
Yeah, you would get tightening and you would get jawline definition for sure. And probably some lifting in the face. I like this just overall. We posted a video the other day of microneedling radiofrequency with my Aerify mask. How amazing did that skin look?
Really well. So well.
This will allow us the skincare products to get into the skin as well.
Do acne scars come back?
They can't, no, they don't come back, but the skin changes as time goes on. So if you do a few treatments and it improves and then you lose weight or you don't continue, it's like working out, you lose it. Okay, let's wipe off the other side.
Diligent with his movements and passes, great job.
I'm very diligent, very. All right, here we go.
Do you give discounts when a patient goes live?
Not
DM?
usually, you guys. Honestly, my patients tend to just like to come in and educate. The goal is to help other people. It's not always about money, okay? It's about helping people. And
that's how we teach a lot of people this. We teach a lot of patients about this and we teach a lot of other providers.
And you guys can see, look at the strength of this device. This is really puncturing deep, which is why she feels it a little bit more, but it's very effective. You guys see it's going into the skin diligently. again, these areas I've
So
circled.
Lieutenant, please tell a patient thank you very much for being willing to share her journey.
Oh, thank you. That's very nice. Actually, it was her first time being on a live. She was very nervous. She did great. But it's all about helping others, you guys, and the only way to do it is through education, and that's what we're doing now. When I started this, it was all about education. It was all about making sure you guys get informed decisions. And again, we use a lot of these treatments before others because we're really working with the companies to develop these. This area she's going to feel a little bit more because this is in the temple. It's closer to bone, I'm sorry. It's really important. I'm going to turn you right
You want to know
now.
what she's
There you
holding?
go.
That's going to be our cold air just to cool her down, give her more comfort.
It
So
also
so
decreases the swelling later by staying cold.
People want to know how much, guys. Send us a DM, phone name, phone number. Everything's different depending on combinations, areas, passes, everything we do.
And take a look, you guys, if you zoom in, Jordan, show them all the little dots that are forming. Those are all the perifollicular swellings and also the sort of mends, the area where we create the channels that are getting a little swollen.
Does this get rid of under eye wrinkles?
It can. The plasma pen and lasers do much more there. But it can improve crepiness there. So I'm going to just decrease. I'm going to go just a little bit lighter, another extra pass, different layer. Bear with me. I'm just going to do a second pass over the scar, more deeper scar areas, a different level.
You use stem cells with this also.
We can, you guys. We can use exosome therapy, PRP. We can use A-cell. What are we doing today? We're using A-cell, which is really good synthetic stem cells. You guys know the bladder cells, they turn over the most rapidly of any cell in the body.
People want to know how long you've been practicing?
16 years. You guys are aging me. But I started my practice in LA August 14th, 2014. To be 8 years in August in LA. With 16 years as a doctor. So that's it for the pixel. I want you guys to see both sides. You guys can take a look. There's some swelling. There's a lot of little dots on there. Should we just start the laser?
Let's go with it.
Okay. I'm
Alright,
gonna cover
guys,
her.
we're going to get our Clear and Brilliant ready.
This shouldn't be that painful. You went through the worst part already. Lift your head for me. Perfect. Come on back. Excellent. And use the cold air. Just keep it on. Keep it on your skin.
Two goggles.
Yeah. You have them. So now we're gonna start. It's okay. We'll grab them.
Okay. These are our
Thank
famous
you.
B goggles.
B initiated. All right. We're at B status. So now, this is our Clear and Brilliant, the original. And the original goes deeper. It's more for scars. You guys see me a lot using the blue handpiece, which is called Permea. Do you feel it?
A little bit.
Okay, shouldn't be too bad. But this can give a really nice result. We did a treatment yesterday doing the same combination on one of our patients that had a severe traumatic scar. He looks amazing today. Maybe Georgie could post that actually.
I will. I gotta
Repost the live
stories.
and then show him what he looks like today.
I'll give you guys a recap of all of our New York patients. We'll share all the live. We'll show you all their current status.
The other thing I want you to see is she has a lot of milia, a lot of sort of, we call these the closed pores, comedones. So the Clear and Brilliant's gonna break those apart, clear up her skin a lot. She's gonna start doing our skincare protocols, do a
What's
peel.
great to apply after this?
What?
So
Well,
what is great-
Aerify is great to use after this. That's my kit. Obviously, you guys can go stronger and do things like Enlighten or Cosmolon. For healing after laser and after pixel, turn your head left for me. Perfect. You want to do things like Hyla B for my Emerald skin line, AOC for vitamin C. Phyto Plus is a great botanical calming agent with hyaluronic acid and cucumber from SkinCeuticals. Anti-age serum, my Refit Face and Eye, which are our Refit Face and Eye, which are our peptides and growth factors. Do we have a mask over there? Any of y'all? Can you grab one? A mask? I'm going to show them my Emer skin mask as well.
So is that gamma rays?
No. No one uses gamma rays, guys. It's dangerous. So we also use immediately after, Rosa could show, our Emer Skin Intense Hydrating Mask. This has in it Hyla B, hyaluronic acid, AOC, 20% vitamin C, our growth factors and from our Refit Face, as well as licorice root, tea tree extract for acne and anti-aging, peppermint for cooling, and a bunch of botanical extracts. People are loving that mask, and I love the package that I made.
Once that, guys, EmeraldCosmetics.com. You guys go to Emerald Skin. You'll see it there.
I would tell you in a treatment like this, I would do one of the masks now, I would do one tonight, and then I would do it twice a day for the next 3 days. That will help you heal. You can also use the mask after you derma roll. So if I do weekly derma rolling at home, and then I apply a mask on right after. Okay, turn right now for me. So you guys can see with the Clear and Brilliant, very quiet, it's easy to do. This energy is going on.
Very low downtime. Our patient that had it yesterday, he looks pretty good today. You can just put on some Fusion Shield, go out, and no one will know that you did laser.
Right, and he's using my Fusion Shield SPF, which has a little bit of tint. He also did Pixel. So that same combo, what do we call that combo?
It's our Tight and Bright.
It's a Tight and Bright procedure. It's excellent. And we're doing this to improve her scars. So I'm doing more passes, you guys can see over the scars. But this is going to be also anti-aging. It's going to get rid of a lot of her clogged pores. It's going to, discoloration will improve. Air just ran out. We'll get a little more air. Air is back on. Good. And so this is a procedure you guys can do with minimal downtime. Even though it looks like it's aggressive, all the blood will be gone later tonight. And she'll look fine tomorrow.
We'll enjoy her Friday night too.
Exactly. Frisky Friday. Who knows what happens on Friday.
Frisky people on here.
Yeah, they did. They were. Maybe that's what it is, Jordan. It's Friday night. It's Friday the 13th. That's probably why. Oh my God.
Yep.
I forgot. Already forgot.
Like, Clear and Brilliant be done with melasma.
Yes, actually it's made for that. It was originally designed for pigmentation and to push products into the skin. That's why the Permea hand piece is called Permea. It means permeation. Okay, it uses the laser to create channels in the skin, and then you put the skincare products on immediately. Vic Narkar and I, years ago, did a study, did a study that looked at using vitamin C and hydroquinone right after laser. And everyone at the time said, never to do that, never to do that. What did we do? We did it. And what did it do? It gave a better result. So why are we doing it? It works. So she's gonna apply her products immediately and continue doing that. Pain level, what is it?
I'd say about a 5.
Okay,
Or
yeah,
it's actually, it's not too bad.
because when we do more passes,
Yeah.
I feel like you feel it. Initially, when you do it, those like almost nothing.
Yeah, no. At first
Yeah.
it wasn't bad.
So this is going a little deeper than the Permea, you guys. The Permea's a 1927, so it's a little more superficial. This is our
People want to know the cost,
1440.
guys. Send us a DM, full name, email, phone number. We'll reach out to you.
Like there, it doesn't feel bad.
No.
It's like this little tickling feeling.
I know. A lot of people say a cat's lick. I don't know.
I don't know, I'm allergic. So
I am too. I'm really allergic to cats.
that would be really bad.
I like them, but I can't. I'll go to the hospital.
Yeah,
Not good. So no cats are licking me.
same.
My friends are like, but my cats don't have hair. I'm like, it's not the hair. The protein in cats that you're allergic to, where is it? Where is it located? Does anyone know? Trick question. Where is the allergy from a cat? It's not in the hair. It's in their saliva. So why does everyone think it's in their hair? Because cats lick their hair all the time. They're self-cleaning. Do you need to bathe a cat? No. If they lick their hair, the saliva goes into their hair, and then their hair, when it falls off, goes on you, and you get the allergy from the saliva that's on the hair. That's why cats' allergy can last for months in a room, because the hair can stick on a wall and for months. It's crazy. Those cats.
Yep.
Crazy cats. My brother's cat was one of the biggest cats in the world, 60 pounds.
Oh my god.
I have pictures of it. I don't have it for you to show on Instagram right now, but I could show them for you too at some point. Jordan would love that cat.
It's like a dog.
It wouldn't stop eating. It wouldn't stop eating.
It's like a tiger.
What?
I'm allergic to cats. No.
No, I'm just saying he would love to see a cat that was that big. Jordan likes dogs.
Can you tell what this is for, please, in Spanish?
Rosa.
Rosa.
So, este tratamiento también se puede mejorar los cicatrices del acné. Hay diferentes dos tipos de vamos a decir en Spanish. Dos diferentes tipos de este laser que pueden usar. Uno es para los líneas finas, como este es para las líneas finas, el acné, las cicatrices, todo así. Y tenemos otro que le ayuda el color de la piel.
How often should you be doing Clear and Brilliant?
Clear and Brilliant, the first couple of treatments you usually want to do about a month apart. After that, you can space it out every couple months. The more you do it, the better. She's doing the pixel with it, wait a little longer. We're planning to do a bigger treatment anyways on her. So this is a good starting point. I just wanted her not to wait. I wanted her to start to get treatment now. So I wanted her to start to get results. It takes a while for these scars to improve. So we really need to start the process, even if it's not with a bigger laser.
So this is going to be doing some Spanish live when she starts.
Perfect. Why not?
It's
Hi.
Perfecto.
I can't read them.
That's really it, you guys.
finishing up.
That's our CMB combination, our Tight and Bright with both Pixel and the Clear and Brilliant. You can see she's just really just red. It's not bad.
There goes one more.
Pero eso ya está destrozando.
What did they ask me?
Thanks.
What did they ask you now?
I don't know what they're saying disgusting, but I don't know what they're like. This is something right here.
Alright,
Alright,
hold on.
guys.
So that's it. I'm gonna put the A-cell on. Or Rosa, you wanna put the A-cell on and explain it?
Yeah.
So Rosa's gonna put the A-cell on, keep the air on there, and then that's it. We finished our Tight and Bright and our first step in our acne scar treatment. Rosa, explain
Alright,
A-cell.
here's our A cell. This is our stem cell. It helps with your healing of the skin. It helps with the collagen. It helps to help remodel the scars. It kind of reduces the healing time after doing laser, so it helps a ton. You can do this. You can also do PRP. It doesn't have to be separate. You can do it together. You can do PRP with A cell. Yeah, that's pretty much it, right? You could also use this for other treatments, or no, just this, right? That's it.
Alright, guys. Thank you for joining us. Stay tuned for all the results.
How was it?